Most people grow up hearing that daily walking is the secret to staying healthy. For decades, doctors, trainers, and wellness programs have repeated the same message: walk more, live longer. And while walking is still one of the safest, simplest, and most effective activities for people of all ages, many orthopedic surgeons are now warning that once you cross the age of 75, walking alone may not be enough to maintain the strength, mobility, and independence your body needs. The human body changes dramatically after 75. Bone density declines, muscle fibers shrink, ligaments stiffen, balance becomes less reliable, and recovery takes longer. Orthopedic specialists see this every day. They meet seniors who walk daily yet still struggle with joint pain, weak legs, poor balance, and difficulty climbing stairs or carrying groceries. Many seniors wonder how someone who walks 10,000 steps a day can still feel unstable, fragile, or easily fatigued. The reason is simple. Walking works the cardiovascular system, but it does little to fight the rapid muscle and bone loss that accelerates with age. Around 75, the body begins losing muscle at a much faster rate. This condition, called sarcopenia, affects nearly everyone, even those who stay active. An orthopedic surgeon once described walking as maintenance, not reinforcement. In other words, walking helps keep the system moving, but it doesn't push the muscles hard enough to grow, strengthen, or protect the joints. When your legs, hips, and core become weaker, walking alone can even become unsafe. With less muscle surrounding the joints, every step applies more pressure to the knees, hips, and lower spine. This can lead to pain, limping, slower walking speed, and a higher risk of falls. Surgeons repeatedly see elderly patients arrive with hip fractures, wrist fractures, and knee injuries that could have been prevented with just a little more muscle strength. This is why orthopedic experts now emphasize something very specific: seniors need resistance, not just movement. And surprisingly, this doesn't mean heavy weights or complicated gym exercises. It simply means giving your muscles a reason to work. Resistance training can be extremely gentle. A chair, a wall, resistance bands, light dumbbells, or even your own body weight is enough. What matters most is consistency and intention. A leg muscle that is never challenged gets weaker. A leg muscle that is challenged, even lightly, gets stronger. Strong muscles protect bones, improve balance, stabilize joints, and keep posture upright. Weak muscles do the opposite, putting enormous strain on cartilage and ligaments. After 75, balance becomes one of the most important predictors of long-term independence. Walking improves endurance, but it doesn't significantly enhance balance because balance relies on muscle strength, core stability, and neuromuscular control. Surgeons often point out that more seniors fall at home while standing still, turning, or getting up from a chair than while walking outside. This shows that the real danger isn't the walk, it's the everyday movements that require strength. A simple squat to a chair, done slowly and safely, can improve balance more than thousands of steps. Lifting light weights builds shoulder and back strength that improves posture. Even holding onto a countertop while lifting your heels strengthens your calves and ankles, helping your body respond quickly if you start to trip. Many seniors believe they will injure themselves if they try strength exercises. Orthopedic surgeons strongly disagree. They say the real risk is not exercising. Muscles that go unused weaken so much that even small movements become dangerous. A person who strengthens their legs twice a week is far less likely to suffer falls than someone who only walks daily. Gentle strength work can reduce joint pain by stabilizing the structures around the joints. It can make climbing stairs easier, lifting objects safer, getting up from bed smoother, and long walks less tiring. The most recommended exercises for people over 75 are incredibly simple. One of the first is chair squats. This movement teaches your legs to support your body weight properly. Sitting down and standing up without using your hands builds thigh and glute strength. Even 5 repetitions a day make a difference. Calf raises are another essential. These strengthen the lower legs and improve ankle mobility. Orthopedic surgeons say that well-trained calves act like shock absorbers, helping reduce the impact on knees and hips during walking. Wall push-ups help restore upper body strength without stressing the wrists or shoulders. A strong upper body improves overall posture, reducing back pain and making everyday tasks easier. Step-ups, using a low step or stair, strengthen the hips, thighs, and stabilizing muscles that prevent falls. Resistance band rows help maintain back and shoulder mobility. Orthopedic surgeons often recommend bands because they are gentle, safe, and very effective at building strength gradually. Walking does not need to be replaced, it needs to be supported. Walking strengthens the heart, boosts mood, increases blood flow, improves memory, reduces stress, and keeps joints lubricated. But without stronger muscles, walking becomes harder each year. Strength training, even for just 10 minutes a day, transforms how walking feels. Legs feel lighter, steps feel more confident, breathing becomes easier, the body feels more stable. The goal is not to lift heavy weights or train like an athlete. The goal is to stay independent. Orthopedic surgeons repeatedly emphasize that independence is built through strength. Without strength, mobility declines. Without mobility, balance declines. Without balance, falls occur. Once a severe fall happens, recovery becomes harder with age. Many seniors lose their independence not because their heart is weak, but because their leg muscles are too weak to support them. Adding resistance makes all the difference. This is why surgeons encourage seniors to perform strength exercises even more than walking. They want people to understand that walking alone is not protection, it is only one part of the puzzle. The good news is that the body responds to strength training even in very old age. Research shows that people in their 80s and 90s can rebuild muscle. Even those who have been inactive for years can regain mobility. The body never loses its ability to improve when challenged gently and consistently. A 90-year-old man can regain enough leg strength to climb stairs again. An 87-year-old woman can rebuild muscle and reduce her risk of falls by more than half. The idea that it is too late is one of the biggest myths harming seniors today. Strength is not only physical, it is mental. When seniors start resistance training, they often feel more confident, motivated, and energetic. They stand straighter, breathe easier, and move with more stability. Their joints hurt less because their muscles take over more of the workload. Their heart health improves because stronger muscles require less effort during daily activities. Their brain health improves because exercise increases blood flow to the brain. Seniors who add strength training feel empowered. They realize that aging does not have to mean decline. It can mean transformation. Walking alone does not offer this transformation. Strength training does. Orthopedic surgeons explain that the biggest improvement often comes from training the hips and thighs. These are the body's most powerful muscles, and they weaken the fastest with age. Weak hips lead to shuffling steps, unstable balance, and joint pain. Strong hips create smooth walking, better posture, and more controlled movement. A simple daily habit can help. Stand behind a chair and lift one leg to the side. This strengthens the hip stabilizers. 10 lifts per side can improve balance within a few weeks. Another helpful movement is a slow march in place, raising the knees. This improves core and hip strength. Many seniors quit exercising because of joint pain. Surgeons explain that this pain often comes from weak muscles, not damaged joints. When the muscles around the knee or hip are weak, the joint absorbs too much pressure. A stronger muscle reduces this pressure, allowing the joint to move freely again. Pain decreases, walking becomes easier, and mobility improves. Breathing is another benefit. Strength training improves respiratory function. When the core and back muscles are strong, the lungs have more space to expand. This leads to better stamina during walking and daily activities. Seniors who combine walking with resistance training often notice they can walk longer distances without getting tired. They can climb stairs with fewer pauses. They can stand up from the floor more easily. They can carry groceries without strain. They can maintain independence for years longer. Orthopedic specialists see these results repeatedly and want seniors to understand the power they have over their own bodies. Walking is a wonderful habit. But walking alone cannot rebuild lost muscle, restore balance, or protect the bones. It cannot prevent the natural decline that accelerates after 75. Strength training can. The ideal routine for people over 75 is simple. Walk daily for heart health and circulation. Add resistance exercises 2 to 3 times a week. Practice gentle balance drills. Stretch lightly after movement. Rest when needed, and stay consistent. The most important thing is to start small. There is no need to do everything at once. Begin with one exercise per day. Even 1 minute is progress. Over time, add more. Progress comes from consistency, not intensity. Orthopedic surgeons warn that inactivity is far more dangerous than exercise. Muscles weaken quickly when unused. Joints stiffen. Bones lose density. Balance declines. The simple act of challenging the body gently keeps everything working. Walking keeps you moving. Strength keeps you standing. Together, they keep you independent. Seniors who combine both live more vibrant, confident, and active lives. They move with purpose and stability. They remain capable of doing the things they love: gardening, traveling, cooking, spending time with family, maintaining their home, and enjoying life without fear of falling. The biggest lesson orthopedic surgeons want seniors to learn is that movement is medicine, but strength is protection. You cannot slow aging completely, but you can build the strength to age well. If you are 75 or older, walking is a wonderful start, but it is not enough on its own. Add gentle resistance. Strengthen your legs, core, back, and hips. Do simple daily exercises that support your body. Over time, you will feel the difference. Your steps will become lighter, your posture straighter, your movements smoother, and your confidence stronger. You will not just walk, you will walk with power. And that is what truly keeps you healthy in your senior years.